Hello, today we are going to discuss a little bit about a really common and a very dangerous problem that has entered our society for a long time and remains unaddressed mostly. We're talking about hepatitis, mostly viral hepatitis. Now, how does viral hepatitis differ from other liver diseases? Most liver diseases like alcoholic liver disease, non-alcoholic fatty liver disease, etc. are non-infectious, while viral hepatitis is infectious, and therefore with the correct measures we can curb it and eventually we can get rid of this disease. The WHO estimates that in the Indian population 35.3 million people have been infected with hepatitis B and C viruses. This is the 2022 data, out of which 29.8 million people are infected with hepatitis B, while 5.5 million people are infected with hepatitis C. These are the two types of chronic hepatitis viruses. India carries 11.6% of the global burden according to the 2022 data. It is second only to China. There are 5 types of hepatitis viruses: hepatitis A, B, C, D, and E. Out of these, hepatitis A and E have a similar mode of transmission, while hepatitis B, C, and D have a similar mode of transmission. Hepatitis A and E are transmitted via contaminated food and water. They have what we call in our medical language the fecal-oral route of transmission. So the best way to prevent hepatitis A and E transmission is to practice clean drinking water practices, to have good personal hygiene and good and safe food habits. For hepatitis B and C, these are the cornerstones of preventing transmission: safe blood and blood product transfusion practices, safe needle and syringe practices in hospitals, clinics, industry like tattoo industry, etc. Targeting high risk and vulnerable groups like IV drug users, education and awareness in the general community using information and broadcasting, social media, television, etc. The best way to counter the transmission of hepatitis B and C is for education and awareness of the population as a whole, and to address the more vulnerable groups, especially people who use drugs, especially who have IV drug usage problems. They need to be addressed to prevent hepatitis B and C transmission, as they are the hotbeds of transmission of these viruses, and from them this is going into the general population. So they need to be educated and made aware. This needs to be done via information and broadcasting, social media, television, and programs undertaken by the government. Hepatitis B and C transmission needs to be countered in a different manner. We need to emphasize on safe needle, safe syringe, safe blood product transfusion facilities in our hospitals, in our care units, in our district hospitals, in private clinics, etc. This needs to be done by making the healthcare workers, including doctors, nurses, and the other staff, healthcare staff, aware of these practices. Also, mothers need to be screened for hepatitis B and C, as hepatitis B and C can be transmitted from mother to child, and hepatitis B immunoglobulin can be given to the child at birth to prevent the transmission of this virus to the child. Okay, so what are the symptoms of hepatitis? Hepatitis also presents in 2 different ways. One is hepatitis A and E. The presentation is quite similar. And the other is hepatitis B and C. So we'll be talking about these 2 separately. First, let's come to hepatitis A and E. Hepatitis A and E usually present with an acute viral illness-like syndrome, which lasts from a few days up to a few weeks. And it starts off with nausea and loss of appetite, fatigue. Patients then go on to develop jaundice, abdominal pain, vomiting, and slowly and steadily it's more of a self-recovering viral infection, which eventually patients recover from without any complications. Now, this is in most cases. Sometimes hepatitis E can exist in pregnancy, and in a few cases in that situation, hepatitis C infection can lead to acute liver failure. It's very rare with hepatitis A, but there have been cases of acute liver failure even with hepatitis E. Now let's come to hepatitis B and C, seemingly more dangerous of the viruses. Hepatitis B and C, usually the patients will not have any specific symptoms as the viruses infect them till they come to a later stage. In some patients, there can be bouts of acute hepatitis or jaundice in between. So many times, the infections go unnoticed till chronic liver disease actually develops. Let's first talk about hepatitis B. So hepatitis B, if a patient is infected with hepatitis B, in about 70 to 80% of the cases, if the immune system of the patient is good, the hepatitis B virus is cleared of the body by the patient's immune system itself. However, in 20% of the cases or more, this leads to chronic hepatitis, which leads to chronic liver disease. Also, hepatocellular carcinoma can occur after cirrhosis of the liver. When we come to hepatitis C, most of the cases of hepatitis C, about 80 to 85% of the infections slowly and insidiously lead to cirrhosis of the liver, which again can cause hepatocellular carcinoma later on. So the endpoints of hepatitis B and C are quite similar. Hepatitis B and C both seem to have the same endpoints, but the cause of these two diseases is quite different. Now let's come to what do we do about it? What are the ways we counter this disease? What are the treatment options? What are the vaccination options? Treatment options now are available for both hepatitis C and hepatitis B viruses for patients infected with hepatitis B and hepatitis C infections. There are antiviral drugs that are different for both and are available in the market. The treatment differs because hepatitis C treatment is very effective and the treatment lasts usually about 3 to 6 months. And the patients are generally cleared of infection and are pronounced cured. They just need to follow up with their doctor. When it comes to hepatitis B, it's a bit more tricky because even though medication is available and it is quite effective, a lot of the patients have to take lifelong medication for hepatitis B, which does become a burden on poor patients or patients who have low incomes. So that is an issue that has to be sorted as we go along in this fight. About vaccinations, there is no vaccine yet developed for hepatitis C, even though scientists are at it. About hepatitis B, we of course have a very, very effective vaccine which is administered to infants at birth and then at 6, 10 and 14 weeks of life. Adults can also take this vaccine. There are 3 doses at 0, 1 and 6 months for adults. So even though we have such an effective vaccine, the vaccination status of Indians is quite poor at the moment, with about 45% of children under the age of 5 not being vaccinated. So we can definitely improve upon this, and there is a lot of scope to improve and to rid ourselves of this menace. Thank you.